Good evening, I'm Ken Perry, one of the Trident emergency physicians. I'm right now coming to you from Centerpoint, one of our freestanding emergency physicians here at the Trident Health System. We figured we would bring some information to you, and really knowledge is power, as we all know. So we thought we could bring some information via Facebook and all of these different mediums, so that way you understand truly what it is that we do here in the emergency department. Let's start with what I am. I'm an emergency physician. That means that I went through medical school at Tulane, and then I did a residency training in emergency medicine. I went to New York Presbyterian for for 3 years, and I went to LSU for one of them. After that, I took tests to make sure that I had the right knowledge and the same knowledge as most emergency physicians, and now I'm a board certified emergency physician. That's what we are in our Trident Health System in the emergency department. We're board certified or board eligible, meaning we all have completed emergency medicine residency training. Well, what does that mean for you? It means that in our 4 facilities, 2 medical centers at Trident at Somerville, and our 2 freestanding emergency departments at Moncks Corner and here at Centerpoint, you get to see board certified emergency physicians 24 hours a day, 7 days a week, and as our families will tell you, 365 days a year. So what does it mean that we're a freestanding emergency department? Both in Moncks Corner and here at Centerpoint, it means that you can come to us for everything, every one of your woes, all the way up to things like a stroke or a heart attack. We have here capabilities to talk to our neurologists. We're able to get you the right treatment. We are able to take care of cardiac arrests. We are able to take care of anything that comes through our doors. That's kind of what we do. We're ready for anything that comes through. So one of the things that we've really realized is patients don't always know what we do in the emergency department, who we are, what it means when they go to the ER, and what delineates us and what's different between us and their primary care doctor. When you come to the emergency department, you come in, you get greeted by one of our techs, you get greeted by one of our nurses, and you tell your story, what was happening that day, why you are not having the best day. We try to change that. Once you come in, you say what's wrong, you give us a history, you give us kind of when your symptoms started, and then you talk to a nurse who then takes your vital signs. This is the triage process. We hear this a lot, and of course people who watch television certainly know that there's a thing called triage, but it's a real actual place in the emergency department with a process that is important for us. We're able to put together your symptoms, your age, your vital signs, how fast your heart is going, what your blood pressure is, with your symptoms. And then we assign a number. This number is a number that the nurse uses a peer review, which means science has made sure it's working appropriately, and we get that number. 5 is for people who might need their wound checked or sutures removed, all the way up to a 1, where it means that a physician should be at bedside immediately upon arrival into the emergency department. All good things, and most people end up in the average, so most people get a triage level 3. It's important because although we would love to say we have a nurse and a doctor for every patient at every moment, sometimes we need to take numbers of patients at different times. So our triage level allows us to determine who we should see and who needs to be seen before other people. You've talked to that nurse, and unfortunately sometimes you have to wait a little bit of time before you see another nurse, or you get brought to a room or to a chair, to another bed in another part of the emergency department. This is just another part of the waiting process. Anyone who's gone to the emergency department, usually their story, it constitutes, this is what happened, and then I waited this amount of time. We try to minimize that, of course, but there are some things that you need to know about what we do and why the waiting is so important. Once we get you to a room, labs, x-rays, CAT scans, sometimes an EKG, and other things need to be done, and we need to figure out what the next step is, what we need to do to treat you, to make sure that your day, which certainly didn't start off with, I think I'm going to the emergency department today, changes to a day that says, you know, I had a great experience in the emergency department, and thankfully they treated me and I'm okay. That's what we go for. Once we're able to get those labs sent off, the CAT scans done, things take 30 minutes to an hour, sometimes longer. And we determine from that point, after talking to you and examining, making sure we know what's wrong, we figure out what we need to do next. Sometimes that means we need to call your primary care doctor or a cardiologist, for instance, or someone else that can add something to your history. Many times it's call a doctor that you've seen that we want to make sure we're not missing something, or to alert them to the fact that you're in the emergency department. They can help us guide things. It sometimes also delays a little bit. Sometimes you would think the medical records we have allow for text messages between different doctors. Well, unfortunately, it doesn't. It's still pretty much old technology. We have to make a phone call. We have to wait for everybody to have a moment to take that phone call and allow us to make sure we're getting you the right care. After all this, there are actually some disease processes, meaning some things that you come in with, that we want to wait for and reevaluate you. Chest pain is a great example. If you come in with chest pain and we don't have to whisk you away to the cath lab where you see a cardiologist because you're having a blockage in your heart, sometimes we want to wait 3 hours to get another blood test. All this does is make sure that we know that we're treating you the best and that we're not missing anything. So all of this really does add to the time that you're waiting in the emergency department. You're waiting to talk to a triage nurse, you're waiting to get brought to a bed, sometimes waiting to get a CAT scan. It's not that nothing is happening, it's just that a lot of things are happening and we're trying to get to everything at the same time. Sometimes that doesn't work. But when you do come to the emergency department, what do we actually do? What's our next step? Well, it always depends on what you come in with. Do we need to give you pain medicine? Do we need to give you antibiotics? It's a lot of moving parts, and we certainly want to make sure we're doing everything we need to do. So one of the other concerns is pain. As if you've read the newspaper or seen the news recently, what do we do for pain? It's a big question, and if I had the answer, believe me, I would probably be somewhere in a state or federal capital at this point giving some instructions to different people. I don't have the answer, and it seems like right now we're all trying to come up with the best answer. But what does that mean? When you come to the emergency department, we have to make sure we're doing what's best for you. We have to make sure we're treating your pain and we're giving you things that are not going to cause you addictions in the future. Sometimes it's necessary to give these very strong pain medicines, but sometimes we feel like it would actually be more dangerous. And now we actually have to look online to see if we're doing what's right by you by giving you any of these pain medicines in case you've had them before and you don't even realize that that's as strong a pain medicine as you were given. So all this comes to a point where it really does take a conversation. We certainly like to make sure that we talk with you and let you know what we're thinking. And we'd love to make sure that you know that you can always ask us and approach us and let us know what you're thinking, and so we can have a really good conversation about what's the next step and see what's best for you. One of the things that we do want to do is talk about some of the processes that happen after the fact. You get some antibiotics, you get different things, and you get brought to the emergency department. You get these labs resulted. Now what do we do? And at that point, you have to figure out if we need to give you the antibiotics and admit you, or if this is something we can send you home for. One thing you should always know is if you do come to the emergency department, we really do want you to follow up with your primary care doctor. This is where the difference between your primary care doctor and the emergency department kicks in. We end up not being able to see you necessarily the next day. As I said, we do staff 4 different emergency departments, and we work all the time. So it's not 9 to 5 at the same clinic. That means that if I give you something and I want you to follow up, I might not be able to see you again until weeks later even. So that's why we want to get you a primary care doctor. That primary care doctor is able to make sure you're getting the right blood pressure medications, cholesterol medications, and sometimes it's even get you to the right specialist, so that way you have the right care. All of these things are just the beginning of the process. We're just now starting to get to the nitty gritty, but we're trying to figure out what else we would want to bring to you. So certainly make sure that you look on Facebook, look on Twitter, both myself and Trident Hospital at Trident PR. We're there, and Trident Medical Center is on Facebook as well. If there's any questions or concerns, specifically topics, definitely bring us topics, things that you want us to cover, information that you want to have in your back pocket, so that way you know what's coming up when you come to the hospital. For now, I'm Dr. Ken Perry, coming to you from Centerpoint. Have a good evening.